Sounds great.
Okay, hello everybody. Welcome to the Healthy Joints, Healthy Lifestyle Show. And boy, do I have a treat for you, especially my patients and people out there dealing with menopause and wondering about sex drive. This is going to be hot topics. And for that, I have the amazing Dr. Sadaf Lodhi, and I am going to give her the opportunity to introduce herself. But for those who don't know me, my name is Dr. Arinola Dada. I help people with joint pain become pain-free, and people with autoimmune disease get their immune system back on track. So, Dr. Lodi, can you tell us a little bit about us and just tell us, this is going to be an very interesting talk today. I'm excited because I got questions of my own. So, yeah, Dr. Lodi.
Hi, thank you so much for having me on, Dr. Dada. I'm so excited to be on your platform. So, my name is Dr. Sadaf Lodhi, and I am a board certified OBGYN in New York. I am also an intimacy coach as well as a menopause and sexual health specialist. So, that's what I do out here in New York.
Okay, fantastic. So in addition, Dr. Lodi has a doctorate in osteopathic medicine at Michigan State, because I'm going to have to brag about you. Did her residency in gynecology and OB/GYN in Michigan, certified as a life and executive coach from Rutgers University, sex counselor and educator, and also practices in New York for the last 20 years. So I just want to make sure they know who they're talking to, okay? Okay, so tell us a little bit about kind of your practice, and then I have a little bit about kind of the questions that are burning questions that I have for you.
Absolutely. So basically, what I do is I help women find their pleasure again, both emotionally and physically, through coaching and also some evaluations and things like that. Basically, what I do is I examine women, and usually women come to me if they're experiencing sexual pain or inability to orgasm and a bunch of sexual dysfunctions. And what happens is that I will examine them, and then I also do a little bit of coaching with them. So I talk about their beliefs and what their thoughts are regarding sex, and if they grew up in an environment where they had sex negative beliefs, then we work through that. We do a little bit of coaching so that even if they're not able to come to sex positive, that they're at least able to come to a neutral point of sex neutrality, so that they don't have all those negative thoughts and feelings when they're about to initiate physical intimacy with their partner, or if they're even thinking about it, because sometimes there can be some conditions, and we can talk about that a little bit later on, that show up in your body even when you start to anticipate physical intimacy.
Yeah. Well, that's actually, that's also important. A lot of patients that I have, some of them have had, arthritic conditions since childhood. So that really, I think, affects kind of how they view sex, and some of that is also maybe just their environment and their families. Okay, let me ask you. I'm going to start with my most burning question. So, how would menopause affect sex drive, would you say?
Yeah, so that is a fantastic question. A lot of women are concerned about that and asking about that. So, for those individuals that may be listening or watching that are not sure what menopause is a condition that when we are lucky enough, we get older and we no longer menstruate. So, when you don't have a period for a whole year, you're in what we call postmenopause. And during postmenopause, what happens is that our hormones go down. So, our estrogen goes down very close to zero, if not zero. And also our testosterone will also go down, and our progesterone goes down. And when those hormones go down, they significantly affect our sex drive. Estrogen affects it by causing what we call gender urinary syndrome of menopause. And so women can notice vulvar itching and burning and discomfort and pain with sex. Anytime you have pain, you're not going to want it, right? So when women experience pain with intercourse in menopause, that decreases that desire. And also the decrease in testosterone. We know that testosterone is responsible for libido. And so when that goes down in our bodies, our libido also goes down. So absolutely, a lot of times women will experience pain with sex, and then with the decreased estrogen, will experience a decreased libido. So that's oftentimes how menopause is correlated with sex drive.
So that's interesting. So it's a double whammy, right? Not only do
Yeah.
we lose estrogen, we lose testosterone. So it's painful to have the sex. And even if you're gonna grin and bear it, your testosterone is down, so your libido is down too.
Yeah. Yeah.
No? Okay, I know you're gonna tell me how we're gonna solve this.
Yeah.
Okay, and then so does menopause, but would you say that most women generally, you think, is that a kind of a rule of thumb then that we can expect that when once you're menopausal, we can expect a lower sex drive in women? Or what are your thoughts from your experience?
Yeah. So, although these things do happen and there is definitely relief. And so we'll talk about those things as well that can help and alleviate those symptoms. But, interestingly enough, not all women feel that way. And in fact, a lot of women feel liberated in menopause. They don't have to worry about pregnancy. Their kids are older. They don't have to worry about them walking in, when they're being intimate with their partner. Some women will actually find that they have a higher sex drive because they're just not worried about their periods. They're not worried about, ovulation and all of those things. And so a lot of women embrace getting older and really enjoy it. So, it's not decreased libido doesn't have to happen across the board. And we know that women are not a monolith. What happens for one doesn't necessarily happen for another, but that there is a spectrum. And some women love being in menopause and other women have a harder time with it.
Yes, yeah, it's so important to remember that, yeah, we're not when we vary, right? And even those fluctuation and even if your estrogen is decreased, it was decreased to where you start from, where you started from, right?
Yeah.
And so we may not necessarily, replicate the same experience that someone else is replicating, but we can still have empathy for those people. So you're
Yes.
going to tell us how to fix the vaginal dryness problem.
Yes, I am absolutely. So, what we say in sexual health that one of the most important things that you can do for yourself as a cisgender woman is to take vaginal estrogen. So, use vaginal estrogen as a cream, or it comes in tablets, or it also comes in a ring. And it's so important because what vaginal estrogen does is it improves the epithelium, it improves the tissue in the vagina. It improves the tissue, the vulvar health. It prevents our labia from becoming smaller and going back to that hypoestrogenic state that we were in before puberty. It also helps with your bladder health. It prevents recurrent bladder infections. And it increases lubrication, it increases blood flow to the genital area. So it does all of those things. So it really is important. And it behooves us as physicians to prescribe vaginal estrogen to our patients because that is really, really what helps. And also, it prevents the vaginal microbiome from becoming such that it has recurrent infections. So if we use vaginal estrogen, it basically brings back that normal vaginal microbiome that was in there before menopause. So that's why it's so important to prescribe vaginal estrogen in these patients because it helps with so many things. And not only can you use the vaginal estrogen, but also you can use lubrication, you can use moisturizer. So it doesn't have to be all or none, right? You can use the estrogen, which helps with so many things. And then you can also use the lubricants when you have intercourse. You can also use moisturizers. So you can use all three of them, and all three of them will help. But the one that is really the gold standard for the genitourinary syndrome of menopause is really that vaginal estrogen. And it is so, so important to prescribe that and to use it yourself.
Interesting. So, anytime we hear estrogen, right, we get a little concerned, right? And there's all that, all those trials in the past, and there are concerns about, oral estrogen, right? And there's one time we we're concerned about breast cancer. And so and that's obviously with the pills, right? But if we're using the genital, the suppositories or the local estrogen, are there any side effects or concerns we should have with that?
None
Okay.
really. And, of course, if you experience any type of unexplained vaginal bleeding in menopause, always get that evaluated because you want to rule out endometrial cancer or cancer of the uterus. But there is minimal side effects to
Okay.
vaginal estrogen, if there are
Okay.
any, really. It's
Okay.
local. It is
Yeah.
not going throughout your whole body.
Yeah.
It's localized
Yeah.
just to that vaginal area, through to the
Mhm.
bladder and the vulva and all of that. So it's really, really localized there. And
Okay.
in fact, so you had brought up the WHI study that was published in 2002
Yeah.
that stated that estrogen caused breast cancer. And then because of that, a whole generation of women were not prescribed estrogen. And in fact, practitioners such as myself that were in residency during that time
Yeah.
were not taught how to prescribe estrogen and
Yeah.
hormones for women. Well, those same authors have actually retracted all of those statements and in fact have stated, and you can go on their website, you can also check out a book called Estrogen Matters, which I love and is by this author, Dr. Blooming, that talks about what the WHI study did and how it was a huge disservice to women, and that actually breast estrogen does not cause breast cancer. In fact, it helps women later on in life. It prevents cardiovascular disease, it prevents bone loss, it prevents dementia, it prevents colon cancer, it prevents this gender urinary syndrome of menopause, it prevents this brain fog, prevents anxiety, prevents depression. We have menopause, we have estrogen receptors throughout our whole body, and especially in our brain. It's in the brain, it's in the hippocampus, it's in the hypothalamus, and it's in the amygdala, which also creates emotional fluctuations. And so that's where we get the mood swings. And so that's why it is so important for us women as we get older. Definitely, there are some contraindications. The contraindication may be that if you have, an active breast cancer going on, or if you
Yeah.
have a history of blood clots,
Yeah.
if you have some type of liver disease,
Yeah.
definitely there are some contraindications. But
Yeah.
for the most part, most women can take estrogen. Now, can anyone just pick it up? No, you have to have that conversation with your doctor, but your
Yes.
doctor definitely should be able to prescribe it for you. And I would say that the transdermal estrogen, so the
Yes.
patch, is definitely much safer. The oral estrogen is safe as well, but sometimes you
Yeah.
can see it affecting your blood pressure, or it can affect your cholesterol. And
Yeah.
so the transdermal patch, which
Yeah.
is the estrogen, will not affect, it's lipid neutral, meaning like it will not affect your cholesterol. It even in women that have high blood pressure, they can
Yeah.
take transdermal, so they can take that patch, they can take that
Yeah.
estrogen as well as their as long as their blood pressure is controlled. And even women that have migraines with aura are able to take the patch. So definitely, discuss it with your doctor. And
Yeah.
it is a shared decision-making process. But you
Of
need to
course.
be empowered to make that decision. You need to
Yeah.
have the proper information and definitely do your own research, because all of those statements that, and I would say actually all of them that were published in the WHI study
Yeah.
have
Mm.
all been retracted.
And that's
So,
it. Yeah. And
so
that's
that's why
exactly
it's so
when I
important.
was in residency too, right? So they really scared us of estrogen, right?
Oh, yeah,
And it was
absolutely.
like, yeah, you're gonna breast cancer, you're gonna get strokes, you're gonna get this, you're gonna get that. So it's so important for us now to, and you know how it is, bad news spreads faster than good,
Yeah,
right? So we
absolutely.
have good news now, right? Which is that, for women postmenopausal, estrogen is helpful. Whether you want to think about the topical or the suppositories, or you want to think about the patch, or you talk to your doctor about the pill, because it looks like overall, where we're looking at women's health, there's actually much more benefits, and most of the concerns have been found to be void. And can you repeat that website again where people can go to get that
Yeah,
information?
yeah, absolutely. So you can actually go to the
Menopause
menopause-society.org.
Society.
Right.
Okay.
So I'm actually a Menopause Society certified practitioner. Actually, I didn't mention that, as well as an Ishwish fellow. And you can actually go to the Menopause Society. They have their 2002 recommendations for hormone replacement. And so you can go on there and see what the Menopause Society recommends, who they recommend can go on hormone replacement, and check that out, because it's really important to be informed and make informed, science-backed, evidence-based decisions for your own health, right? Because we know that estrogen given within the first 10 years of the last menstrual period, or less than the age of 60, or it could be like, for example, a woman could have had her last menstrual period at the age of 55, you know?
Yes.
She can still go on hormones, even if she hasn't before, as long as she's, healthy. And it is so, so important because what we know now is that estrogen is actually preventative, literally
Yes.
preventative medicine that we can
Yes.
do for ourselves if we're between the ages of 50 through 59 or within 10 years of the last menstrual period. So really
Okay.
important to become informed and make an evidence-based decision for your health.
That's perfect, because that was actually my next question for you. Is there a time when it's too late? And it sounds like that is not, there's no such time.
No, no. I mean, they say after the age of 60, what happens after the age of 60, and if you have not been on hormones, is that the chronic diseases start to have, started to form. So like the
13.
heart disease, sets in, right?
Yeah.
Exactly. We start
Yeah.
to lose osteoporosis, all of those things, which could have been prevented had we started
Vented.
taking estrogen earlier on. We know that heart disease is the number one killer of women
Yes.
in their lives, and so it's
Yeah.
really not breast cancer, it's actually heart
Yeah.
disease. So
Yeah.
super important to just know and understand and just know what your options are. You don't
Yeah.
have to take hormones if you don't
Yeah.
want to, that's really your choice, but
Yeah.
I would say that definitely absolutely take at least vaginal estrogen for your
Yeah.
vaginal health, because it
Yeah.
will help your libido when you're not having pain. It's going to help with lubrication, it's going to help with that blood flow going to your genitals, and all of those things are going to be super important so that you don't have the discomfort, the itching, and all of that pain with intercourse.
Okay. Well, I have a very important question to ask you. How do I improve intimacy with my partner if I am menopausal?
Yeah, yeah. So, we can also talk about improving our sex drive, our libido, but also let's talk about this intimacy first. So,
Yeah.
there's so many things about intimacy that we have to understand. So, intimacy is not only physical intimacy, there are different types of intimacy. There can be intellectual, it can be emotional, it can be experiential, it can be, physical. All of those things are intimacy, right? So intimacy is really just the ability to connect with your partner and also to be able to be vulnerable with them. What you can do, some simple things that you can do, and some power thoughts for women that if they want to increase intimacy with their partner, is to really practice mindfulness. And that increases pleasure and arousal. And I know that, like, mindfulness is a real buzzword right now,
Yeah.
but we've seen there have been studies that have been done. There was one done in 2013 by a physician named Rosemary Basson out in British Columbia, and she noted she put these women into groups, into cohorts, and she did a 6-month follow-up, and there were 90-minute sessions of mindfulness, cognitive behavioral therapy, as well as education surrounding their anatomy and about libido. And what she noticed was that these women, after the 6-month time frame, had increased lubrication, increased arousal, increased desire for their partners, and increased sexual satisfaction with their partners after being in this group. Because what happened is that a lot of times when women are intimate with their partners, they're thinking about 50 other things, right? You being a successful businesswoman, you're probably thinking about your business, your patients, your all these other things going through your
The
head, right?
kids.
So, yes, the kids. And a lot of women are thinking about kids, they're thinking about their chores. It could be a single mom with, working 3 jobs, right? All of those things. There's so many things on our plate that sex just becomes one more chore on top of that, right? So if we are not mindful and if we let our mind wander, then we're definitely not going to be in the mood to have intercourse. When we practice being in the moment without judgment, and we really focus on the senses, we focus on the pressure, the touch, the texture, the sound, the taste, the smell, everything, then we're more present in our bodies. That automatically increases arousal and desire for your partner. So I think that that is something that doesn't require any money. It doesn't require any fancy membership or anything like that. All it requires you is to practice just
Practice
being in the
mindfulness.
moment
Yeah.
and really focusing on what it is that you're doing.
Yeah.
And that will increase the arousal and the libido and the
Yeah.
desire that you have.
Yeah.
Um, I think also what's important is to accept and love yourself as you are right now. I think what happens is that a lot of women will say, like, oh, I just want to lose 10 pounds, or, after I do this or after I do that,
Then I'll be
then
happy.
yeah, I'll be happy and I'll start to love myself. And when I love myself, I can love my partner. Well, how about you just start now? Nobody has any guarantee of
Yeah,
tomorrow, what tomorrow brings.
yeah,
So if we
yeah,
just love ourselves now, then we can
yeah,
have that love to love somebody else. So I think that that is also something that's really important, and
yeah,
realizing that love and intimacy look different as we get older. So as we were when we were in our 20s, right? Our intimacy and our relationships look different. But as we get older,
yeah,
it's a term actually coined by an author. His name is Marty Klein. He wrote this book called Sexual Intelligence. And basically, what that means is that just realizing that as we get older, sex is going to look different, right? Our pleasure, whatever we things we find pleasurable, may look different. As people age, they may start to have some chronic conditions. Maybe they have high blood pressure. Maybe they have diabetes. Maybe they have something that affects, for their male partner, might be affecting their erectile function. It could be affecting, perhaps they have premature ejaculation. For women, maybe they've been having so much pain with sex that now they're experiencing vaginismus, right? So
yeah.
things are going to look different as we get older. So it's going to be really important to kind of work through and find what is the root cause of the pain or the dysfunction that I'm having, and then
Yeah.
how can I treat that to bring that intimacy back into my relationship, right?
Wow. So important. That is so, yeah, that is so insightful, right? And we're living such busy lives, 10,000 things popping up on your phone. I mean, it's crazy. So practicing that mindfulness will be very important. When you shut those things off, you also kind of shut that part of your mind off so you can actually be present and be there so that you can actually have what you do want, which is the intimacy part with your partner.
Yeah, absolutely.
Okay. Can you share a story about a patient who's had an amazing outcome after the benefit of being in your care?
Yeah, actually, I have two patients that I was thinking about. So one is a woman that is postmenopausal. She's in her 60s. And so she contacted me. She is somebody that grew up pretty religious. She grew up a Christian and it was very religious. And what she knew, she called me because she started to experience painful sex. And she thought that perhaps it was because, she was menopausal and that's why maybe all she needed were lubricants and that was it. And that was going to solve her problem, right? So once she and I started talking, I started to ask her a little bit, I definitely, because she was in a different state than me, I wasn't able to physically examine her. So the first things first, I always ask patients to go and be evaluated by their gynecologist to make sure they don't have anything anatomical or recurrent.
Structural, exactly.
Exactly, structural or, recurrent infections or whatever
Mm-hmm.
going on, right? So she went and was checked out and everything appeared to be okay. What she did notice is that, she was menopausal, which I knew, and she was not on vaginal estrogen. So that was the first thing I suggested was for her to go on vaginal estrogen to help with that tissue, because we know that the tissue becomes thinner as we get older, especially if we don't take that vaginal estrogen. So she was prescribed the vaginal estrogen by her doctor. So she started to use that, but she noted that she still was having pain with the intercourse, even after having used this vaginal estrogen. And we talked about lubricants and all that, all those things. But what we really went into, and this is where I love being a coach because I'm able to delve into this a little bit, which is what a lot of physicians are not able to do. And a lot of people don't have time to do, is really get into the thoughts behind what she was experiencing. So what she told me is that she was able to have intercourse before. So she was married before, now she's divorced and
Yeah.
she's in a relationship where she's engaged. And she said that, before when she was married,
Yeah.
she was able to have sex, no problem, no pain, anything like that. But
Okay.
now, since she's been engaged, she finds it very difficult to be intimate. And then we talked a little bit about what her thoughts were surrounding sex.
Yeah.
And what she stated to me is that being raised in a very religious Christian environment, she felt that sex should only happen when somebody is married and should
Okay.
not happen outside of sex.
Okay.
And that was something that was very revealing to herself because she didn't even realize
That was a
that's what
barrier.
was impacting her. Yes, absolutely. So what she was experiencing was vaginismus. Basically, the muscles around the vagina were starting to tighten up in anticipation and fear of having sex, right?
Yeah.
And that the way that her body was reacting was due to her thoughts. So we know, and in cognitive behavioral therapy, and I'm not a psychiatrist, but we know that in cognitive behavioral therapy, we know that our thoughts result in feelings, which then result in actions, right? So her thought was that
Bad thing.
sex outside of marriage is wrong.
The bad thing.
And
Yeah.
so the feeling that she was having was that of guilt and shame, and she wasn't really sure she wanted to be doing this. And so then the way that her body was responding was that the muscles were starting to tighten up and
Rejecting.
contract so that she could not have sex.
Yeah.
And so once she realized that, then she realized that, for her, because this was something that was really important to her, she was just, telling me the things that were important to her and what her values were and this and that.
Yeah.
And because what she was doing wasn't in accordance to her own values, what she valued, what she thought was important, her body was showing up like this. And so what she decided that she was going to talk to her partner and tell him, that they could, of course, do whatever it is that they wanted to do outside of having that penile vaginal intercourse, because for her, that didn't seem right. And so because of our conversation, because of the coaching that I had given her, she was able to gain that insight and figure out why she was experiencing. Because remember, before this, when she was in a married relationship with her previous partner, she didn't have any issues like this. There was no problem at all. And now she was starting to experience this. So she felt a great aha moment at that time, and she knew what the problem was, and she was able to resolve it. So that was one of I think one of my biggest success stories, because we really delved into everything. We delved into menopause, we delved into, sexual health. She was also seeing, because of her vaginismus. So vaginismus is a condition where not only do you need sex therapy or sex coaching, but you also need a pelvic floor therapist to help you with vaginal dilators so that those muscles can start to relax a little bit and get used to something being inside. And because she had been menopausal and also divorced for 10 years now, she hadn't really been having any type of penile vaginal intercourse. And so those muscles were tight. And because she was menopausal, we know that tissue was friable, like it was thin. And, she was having some discomfort with that. So there were a lot of things that went into this.
Were going on.
Yeah. But it was really important for her to see how her thoughts were influencing what was happening in her body.
That's interesting. That sounds like that sounds like a lot to uncover, right? Because especially someone who was already married previously, you'd kind of almost want to dump everything on menopause. I can see most women out there just kind of saying, well, I guess it's menopause, right? And just, rather than kind of maybe being aware of the opportunities to really kind of dissect what the possibilities are. So thank you for that amazing an example of just how we can't just assume it's it's menopause. One, even if it is, there are things that we can now do to treat it safely. And it may not just be menopause, right? There may be some background story going on in your mind that's affecting how your body is reacting. And unless you do the work to try to figure it out, and sometimes you need someone to help you. And so that's kind of where Dr. Lodhi also is able to assist patients kind of walking through that maze.
Absolutely.
Okay. Yeah. So what do you say? I have one question. What do you say to women who kind of feel stuck with the way things are and kind of don't feel like it's ever going to change? I think that's what she could have done if she didn't reach out, right? She could have said, well, that's the way it is. I'm menopausal, that it's over, Fat lady has sang.
Absolutely. So, I think what I would recommend for any woman that feels like that is really to hone down on what the root cause of their frustration is, right? Is it that your libido is higher than your partner's? Is it that, they're not willing to listen? Is it that when you communicate, they start to get angry and walk away and get upset, or they feel that, there's always something wrong with them, and then they feel like you're always telling them that there's something wrong and this and that? I would get to what the root cause of your frustration is and why you're feeling stuck, right? And then if you find that it's a communication issue, so we see over and over again with multiple studies that the number one factor in deciding whether or not a woman is sexually satisfied is communication. That is the number one reason why a woman is going to be sexually satisfied, is if she's able to communicate with her partner her
Yeah.
desires, her wants, what she likes, what she doesn't like, also understanding her own anatomy of what she likes and what she doesn't like,
Yeah.
right? So that really is, I think, what it boils down to for most
Yeah.
people. Sometimes when, if a partner is trying to tell another partner, trying to at least discuss, what I would recommend is definitely not discussing. If you feel like you're having bad sex, discuss it in the bedroom, right? We don't want to do that. We want to discuss it when we're outside of the bedroom, or when you're
Yeah.
walking, taking a walk, or, and again, building that emotional intimacy and getting vulnerable with your partner is also allowing you to spend that time outside of the bedroom to learn more
Yeah.
about each other, right? So
Yes.
I think that is really important. So recognizing external factors that could be affecting your intimacy, identifying things that distract from connection, like you said, whether it's work, it's job, it's children, it's always being
Yeah.
connected on your phone,
Yeah.
create that time and that space for you and your partner. I had that actually in a case for a friend of mine. She was a client rather, and she decided, she was saying how she and her partner had mismatched libidos, and she felt like she always wanted sex more and he wanted it less. And what it turns out, after she and I were talking more, is that her husband has diabetes and is really
Okay.
not controlled that well, so he was
Yeah.
experiencing a lot of
Affecting.
erectile dysfunction. And
Yes.
with that, there was a lot of shame that he felt, and he felt
Yeah.
really pressured by her because she
Yeah.
had a higher libido, and so he had a
Yeah.
lot of performance anxiety. And
Yeah.
so then he would not want to become intimate because he
Yeah.
felt all of that pressure that he was putting on
Pressure.
himself, but he also felt that pressure with her. So what
Yeah.
she decided, and with my coaching, what she
Yeah.
realized is that she and her partner needed to create time in their schedules, because he was a dentist, she's a physician, and so it was
Yeah.
hard for them to mesh their schedule. So what they decided is to actually put time on their phone. We
Yeah.
know, you and I know, that if it's not on the CEO calendar, it doesn't get
It
done,
doesn't
right?
happen.
So if it's not on our calendar, it's not going to
Yeah.
happen. And
Yeah.
so what she started doing is she started putting in just 15 minutes, right? So it
Yeah.
wasn't anything that was really stressful. It
Elaborate.
was it was going to be during a time when both she and her partner were relaxed, and they were
Yes.
just relaxing with each other,
Yeah.
and a time where they could reconnect, and just 15
Yeah.
minutes. So it was on her
Yeah.
phone, and she did that. And so she started
Mm.
doing that all the time. And then
Yeah.
what they realized is that they started to connect more emotionally now, right?
Yeah.
So they were building that emotional intimacy with
Emotional.
each other. They were
Yeah.
becoming more vulnerable with
Emotionally.
each other. And then they decided that, his libido was highest in the mornings, hers was in the evenings. So then what they
Yeah.
decided is that they were going to actually just take turns. Sometimes
Yes.
they would be intimate in the morning, sometimes in the evening, so that
Okay.
both of them
Hey.
were satisfied, and both of them, it
Yeah.
worked for both of them. But in
Yeah.
the end, what the crux of the problem was is that there was no communication,
Communication. Yeah.
and they were just kind of getting by. They were like roommates and not
Yeah.
really talking to each other. When
Yeah.
they actually created that time
Yeah.
in their lives
Yeah.
for each other, that's when
Yeah.
that emotional
Yeah.
intimacy was
Yeah.
created and
Yeah.
built up, and that's when they became unstuck.
Wow, that's amazing. I like the kind of, taking the time, put it on your calendar. We live busy lives, building that emotional intimacy that then kind of enhances the physical intimacy. And
Yes.
so, and even doctors and dentists, we're not above, above not realizing that
Right.
this is what's happening in our relationships, right? So
Right.
thank you. Those are actually very powerful stories of people and patients that have worked with you who've had amazing outcome. So, Dr. Lodhi, tell us, how can people find you?
Yeah, so I am on Instagram and TikTok at Dr. Sadaf OBGYN. I'm on YouTube at Dr. Sadaf Intimacy Coach. I also have a podcast called the Muslim Sex Podcast that talks about relationships and intimacy. I also talk about menopause on there. I have a website called drsadaf.com, and patients or clients can always email me at drsadaf@drsadaf.com.
Perfect. Well, so my name is Dr. Arinola Dada. For those who don't know me, Healthy Joints, Healthy Lifestyle. Please share this video, like it, subscribe. We're going to have Dr. Lodhi's information attached to the bottom of this video. Thank you so much, Dr. Lodhi. I appreciate you coming to the show. Very insightful. Lots of juicy take-home points for us and women our age to really kind of embrace menopause and embrace intimacy and actually take the time to create that emotional intimacy that leads to the physical intimacy that helps us to live our best lives with our partners.
Absolutely. Absolutely. And thank you so much, Dr. Dada, for having me on. I know you are super busy, and I really appreciate the time and effort you do into putting together your podcast and your live stream.
Thank you so much for coming. Bye, everybody.